The topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
What's working on purpose anyway? Each week, we ponder the answer to this question. People ache for meaning and purpose at work, to contribute their talents passionately and know their lives really matter. They crave being part of an organization that inspires them and helps them grow into realizing their highest potential. Business can be such a force for good in the world, elevating humanity. In our program, we provide guidance and inspiration to help usher in this world we all want, working on purpose. Now, here's your host, Dr. Alise Cortez.
Welcome back to the Working on Purpose program. Thanks for tuning in again this week. I'm your host, Dr. Alise Cortez, joining you live from Dallas, which is home base for me. If you don't know me yet, I'm a management consultant specializing in meaning and purpose, organizational logotherapist, inspirational speaker, social scientist, and author. I help companies discover and articulate their purpose to thread it through culture and operations. I work with organizations to develop inspirational leaders who create cultures where people actually want to come to work and do their best. And I provide programs like the Grab Your Gusto that enable individual team members to discover and unleash their passion and purpose at work to catalyze fulfillment, engagement, and productivity. You can learn more about me and how we can work together at alisecortez.com or gusto-now.com. Let me thank my partner and sponsor, WorkProud. We are a perfect collaboration. Everyone wants to know they matter and that the work they do is meaningful and appreciated. WorkProud helps companies do just that through their mobile platform that is built to encourage employees to share stories and recognize each other's contribution. WorkProud empowers HR and business leaders to help create company cultures where all employees are inspired to feel proud of their work and proud of their company. Check them out at workproud.com. With us today are the founders of Ethne, a nonprofit organization that fights poverty and while empowering vulnerable women and children. We have Dalton Divakaran, the founder and president, and Stephy Divakaran, a co-founder who also happen to be married to each other. We'll be talking about the Ethne, how Ethne was born, how it works, and hear some about the programs they've run in service of their mission to empower women and children and save them from trafficking and poverty. We're doing the show live together from the Las Colinas Country Club, where we'll be immediately going afterward to an ABTP meeting, where I'm presenting my research on modes of engagement and our unique connection to work. Full and fun agenda awaits us both on both fronts. Dalton and Steffi, welcome to Working on Purpose.
Thank you for having us.
Thanks, Alise, for having us.
It's so great. It's so great. We have to, of course, tell the story of how I find my guests. I like to do that whenever I can. So several weeks ago, I was here in Las Colinas attending the same meeting for a different guest, and Dalton is introduced and talks about what he's doing at this nonprofit. And so there's about, 50 people in the audience. And after the presentation is done, I made a beeline for this poor young man and put my hand out to go introduce to him. And I'm sure he must have gone like, what is coming at me? It's blowing my hair back here. But I said, I have to hear more about this nonprofit that you're running. Tell me about it. And that's how it began. So thank you for being willing to put up with that first, fresh force introduction.
Yeah, Alise, I just wanted to say that I leave encouraged and inspired every time I have a conversation with you. And the first one was the same way to me as well. So thank you for inspiring us. Thank you for being an evangelist for purpose. We all need that very much. So thanks for all you do and having us on the show.
Oh, you're so welcome. So welcome. It should be like that, right? Just Dr. Seuss says that. So let's get into it here. First, I want to get into for this first segment is really where Ethne came from. And one of the things that I'm already intrigued with is you've got a tagline that says, true passion finds purpose. I love that, of course. And so at Ethne, you and your team stand to use a person's passion as a tool to bring awareness to social injustices and to empower vulnerable women and children. And you want to see women and children of all people groups freed and living a life to their fullest potential. Incredible, awesome mission and purpose. So first, how did you arrive at this notion of passion fueling purpose?
Sure. True passion finds purpose. That's really true. In the same, so I lived that story my entire life, the past 35 years now. And I've struggled with it, and I can be real about it as well, right? It didn't happen overnight. It didn't happen in a month or two, but it was definitely life's journey. And what really triggered that was getting some second chances in life. Um, and it started in 2010. I swallowed a beetle, or maybe I should say a beetle, just somehow aspirated one while I was on my motorbike. It tore my airway, landed in my lungs, and I was struggling to take breath. I was spitting out blood. I somehow managed to get to a hospital. Was there for three days. Finally, they took the beetle, which was poisonous, out of my lungs. And that's the first time I ever thought about purpose. And well, why am I alive, and why did I get a chance to live, and whereas so many others still don't exist? And it really triggered that thought, and from then the journey began actually. And everything since then that I put my hand on, I wanted to make sure that I was converting. If it's something my passion, it was my work, it's something I'm hanging out with my friends, or whatever I did, and I felt that there was a purpose to it. And that's where the journey started. And down the lane, even again, I had to go through other second chances, which I got to live. And was it cancer or other ailments, or if it's accidents? And throughout it, it just ignited that passion more and more to convert whatever I put my hands on to something more meaningful and purposeful. And eventually, I met a group of friends who were also, contemplating, hey, we have great jobs, we have great families, but our life's not really satisfied, and we don't have that joy in living. And what can we do beyond our day-to-day 8 to 5 jobs? And how can we turn our 8 to 5 jobs and even out, our skill sets into something more meaningful? That's when the conversation started with a group of our friends, and we decided, okay, this is what we want to do. We're going to take our skill sets, our passions, be it finance, be it marketing, be it music, be it art. How can we take those passions and bring those passions to a collective purpose? And I reached out to a few of my friends. They were all on board. And we eventually ended up having an organization formed and serving vulnerable women and children all over the world.
And Ethne was born.
Ethne was born, yeah.
Okay, so that's an incredible story. So definitely one thing, you're right. Purpose or passion is absolutely a path to purpose. It's one of at least 4 known pathways. So I completely agree with you. And that you took that's the notion of, how come I'm still here, and what can I do about that? Not just, hey, let's just party for the rest of my life. Let's go make a difference. That's amazing. And I applaud that. It's one of the reasons I wanted to celebrate you both on the show. So now let's talk a bit about, what does Ethne do? What do you actually do to help women and children?
So I can take that question. Ethne primarily focuses on vulnerable women and children. We mainly want to see women and children live a life of freedom. Many of the groups that we work with are often in places or in situations where they've been exploited, usually due to the fact that they come from very poor backgrounds, and it puts them at a high risk of being more vulnerable to either physical or sexual exploitation. And that's our primary focus, is to make sure that these women and children have a way to sort of get out of something that might be generational poverty and really kind of live a life of freedom.
Oh my gosh, that is so amazing. I'm sure you guys have an idea of the numbers. I wouldn't ask you if you don't know them off the top of your head, but this problem has got to be enormous.
Yes. I know that one of the recent statistic that we just kind of know just by our working with groups is that more than 700 million people in the world live daily on a wage of less than $2. It's actually $1.90. So that just kind of goes to show you that, with that kind of an income, the things that they have to compromise on, a lot of times, it's more than just the fact that they're poor. It's that they don't have access to basic things that we have access to, like healthcare or shelter or food, education. All those things factor into having, a quality of life that is needed to be successful. And that's kind of our focus, is to make sure that every individual is in a position where they can position themselves to be successful, position themselves in a place where they are able to, eventually use their own passions and find their own purpose.
Mm-hmm.
And we believe that you can only do that once you, have a basic level of security.
Mm-hmm. Maslow's hierarchy of needs would say that. We'll hear about that later tonight when I give my presentation. But yeah, and how that lands for me is helping individuals to really realize their best potential, their best lives. And the thing is, most of us don't get there alone. We need help, and some of us need more help than others. So
Absolutely.
what I find even more amazing about this, ladies and gentlemen who are watching and listening, is that, it's not like these people are just running this organization full time. They actually have two very separate big careers themselves. So can you each share a little bit about what else you're pouring yourself into? What else takes your time and passion and talents?
Sure. I work for a company called Salesforce. I'm the director for industry advisor for global healthcare and life sciences. So I have been in healthcare for the last 16 years, and I am a nurse by trade, and I started my nursing journey in India, and I experienced firsthand the struggles, not just of patients, but also about healthcare providers and the struggles that they have to go through, even nurses or other staff, doctors. And I decided that I needed to get out of India and learn from some of the very best around the world. That's why I took a huge decision to get out of India, my own country, and to go explore what's happening in other parts of the world. And in fact, that opened up my eyes to a lot of different things. But coming from India, seeing poverty all around, seeing abuse all around, I always wanted to go back and help or give back when I get to a better place. But that learning journey eventually led me to learn more about healthcare. And today I get to help companies and organizations, nonprofits and for-profits around the world. And it's such a privilege. And taking that passion of mine to be in healthcare and carry that to the nonprofit work they do, it really is so rewarding to see that. And it took me a while to get there, right? Whatever I do at work, and that converts automatically to the passion I do outside of work. Mm-hmm. And the journey just culminating at one point it's been beautiful.
Mm-hmm. There's a lot of synergy in that. That's really, it's fantastic. It's not like it's competing. It seems like they're each energizing the other.
Yeah, absolutely.
So great. Steffi?
And I work as a clinical pharmacist by trade, and I really enjoyed it as well. I think it kind of gives, when you're in healthcare, you kind of, I think, have to be a little bit the type of person that, has good listening skills and is a little personable. So I really enjoy meeting patients from all age groups and just really being kind of like the mediator there to help them, consult with them in anything that they need, professional advice on.
Mm-hmm. Okay. Again, another full life here. And then the fact that you're actually working with, friends, I think it's so beautiful that you created something, an entity where you can serve with friends and grow with friends. I mean, that's magnificent.
Sure. Yeah. The idea behind all that was actually, I'm passionate about healthcare. Stephy has been in healthcare, but she also writes. And she does spoken word, she does poetry, I did music and arts. And whenever I got a stage, I started catering people's attention towards social injustices. I didn't need the money out of music or anything because I already had a good job. But now how can I leverage that passion? And when I get a chance to tell the world something, okay, how can I point their attention to something else? And we met like-minded professionals who are equally passionate about finance, passionate about marketing, cybersecurity, and operations. So our team, they're really doing really well in their corporate jobs. Everybody are volunteers in the team. Mm-hmm. But when we came together, something extraordinary happened. Hey, now we can leverage each other's skills to find meaning and also leave a bigger impact than each of us individually could ever do.
That's the sum is greater, the whole is greater than the sum of its parts concept. Yeah. Absolutely. Well, finally, in this last segment, I wanted you to talk about the significance of the name Ethne. Say more about what that means. It's pretty fantastic.
As I mentioned, I migrated here in 2011. Steffi came here much before that. And coming from India, India is a very diverse place. Mm. And moving to America, again, wow, it's not just Americans or Indians, but people from all over the world are here. And this country has paved such an opportunity for all people groups. And the most beautiful thing that I've enjoyed here in this country is meeting people of all ethnicities, regardless of their color or their education or their status. It's so diverse. And the word ethne means people groups or nations. And that was just so close to my heart that, hey, I want to cater to all people groups. And we, at the end of the day, it's the same blood that runs in our bodies. We're just human beings, right? And we cater to people, even though we run a business. At the end of the day, the key stakeholder are the people. And that's the driving force behind the name as well. And I wanted the organization to reflect who we are, and it's people groups, and it's everybody's welcome. And we want to cater and empower people groups who are marginalized and underserved, and we want to make an impact there. That's who we are.
Mm-hmm. Beautiful. So happy to share with my audience. And on that note, let's grab our first break. I'm your host, Dr. Alise Cortez. We're on air with Dalton Divakaran and Stephy Divakaran, the founders of Ethne, a nonprofit organization that fights poverty while empowering vulnerable women and children. We've been talking a bit about how it was born, what got it, what it took for it to be brought into the world. After the break, we're going to talk about how it actually works. Stay with us. We'll be right back.
Dr. Alise Cortez is a management consultant specializing in meaning and purpose, an inspirational speaker and author. She helps companies visioneer for greater purpose among stakeholders and develop purpose-inspired leadership and meaning-infused cultures that elevate fulfillment, performance, and commitment within the workforce. To learn more or to invite Alise to speak to your organization, please visit her at alisecortez.com. Let's talk about how to get your employees working on purpose. This is Working on Purpose with Dr. Alise Cortez. To reach our program today or to open a conversation with Alise, send an email to Alise, A-L-I-S-E, at alisecortez.com. Now, back to Working on Purpose.
Thanks for staying with us, and welcome back to Working on Purpose. Before we get back to the program, I'd like to invite you to check out my book that came out last November. It's called Purpose Ignited: How Inspiring Leaders Ignite Passion and Elevate Cause. It's on Amazon. I wrote it to awaken readers to their passion and purpose and help transform them into inspirational leaders who enliven the workplace and elevate the contribution of business for all of its stakeholders. And I use this content as a basis for my Vitally Inspired Leadership and my Grab Your Gusto programs. If you're just joining the program now, my guests are Dalton Divakaran and Stephy Divakaran, the founders of Ethne, a nonprofit organization that fights poverty while empowering vulnerable women and children. I'm your host, Dr. Alise Cortez. Welcome back. So for this part of things, I want to dig into just really how Ethne works. And one of the things, of course, that we understood as we came in and we began talking about this, I understand that the focus is on addressing the problem of poverty. That's your big focus. Why poverty?
So at Ethne, what we like to say is that poverty is a double jeopardy cause, which pretty much means that a group incurs disadvantages from poverty in more than just one way. Not only are they financially at a bad place, but it also limits their access to, just like I said, basic necessities like education, nutrition, shelter, things that people need just to, advance in life. And oftentimes the groups that we work with, it's not just, one individual, it's actually a generational sort of thing. And it really limits them to not just that person, but for their children and their children's children. So that's kind of the main focus, is to somehow find ways to break this generational poverty. And even if one person out of that family is able to find a more sustainable career or a more sustainable occupation, then they can be that rescue for their family and eventually make sure that they're not in a position where they would be a high risk group that would be more exposed to other kinds of exploitation.
Mm-hmm.
I would add that freedom is really important to our organization. We want to make sure that people are living in freedom. And poverty is one of the primary reasons that people can't live free. And it leads them to one thing or the other. And one of the evils that we fight is trafficking, human trafficking. And the other is labor trafficking. And it's because people are not having enough opportunities either to educate themselves about what freedom is and how to live to their fullest potential, and what limits them to generational curses of what poverty is doing them, and it leads to generation after generation. And that's what we want to break, that bondage of people not living in freedom. And how can we empower women and children, and men as well? Primary focus is women and children, but even men too, to live a life to their fullest potential and to live free.
Amazing. And the way you do it, this is what I thought was so interesting reading the website, ladies and gentlemen, is that I understand, that the team at Ethne use sensitization sessions, research, awareness campaigns, rescue teams. You liberate victims from dangerous or impoverished conditions where their unfavorable circumstances may be exploited by predatory measures. So just listening to some of the actual things that you do is really interesting to me. So tell us more about how you use these programs,
Sure.
these measures.
So the first and foremost, we work together with our partners and like-minded organizations to identify populations who are at risk. And before even jumping into some sort of interventions or implementing what we think is the right programs, we do a thorough analysis of the situation. We do a needs assessment. And from that needs assessment, we kind of find out, obviously we want to fight poverty, but we're really fighting the consequences of poverty in those places. That could be lack of education. That could be lack of enough resources in those communities. One of the examples is like it's in these communities that we serve, there might be a person coming into these families and telling them, okay, your child has nothing. You don't even know that this child would survive the next 2 months because you don't have access to food or healthcare. And we would give your children a better place or a better opportunities if they come with us and go outside of your village or community. And eventually they end up trapping these kids into labor trafficking or human trafficking.
Okay.
And that's loosely because parents are not really aware of what's going on in those communities. They're not educated enough, right? Or neither do they have a means of earning an income that would put food on the table for these kids and opportunities for education and a better life. So what we really do is we do the needs assessment and we identify target groups where we can really have an impact. And then we put our programs in place with the help of our partners. We don't do a lot of rescue ourselves, but we seek the help of our partner organizations who do rescue. And then we come on full hands when it's time for rehabilitation or vocational training. And some of the key areas that we focus is one is healthcare, shelter, and education, and vocational training. We want to make sure that the vocational training part is sustainable, that we don't have to go and help them all the time, and that we're not pouring our money over and over again for the same cause, but they are empowered, and we implement sustainable programs so that the generational curses are broken.
It's just so much to take on. It's amazing. Okay, so I know you work with partners, but the other thing I wanted to talk to, so you just said now that you work with partners with the rescue piece of things. So I think it's interesting that you talk about how you rehabilitate survivors by providing shelter, basic necessities, as well as medical and nutritional needs, which you kind of said, and then a safe place as well. While they also get counseling, health services, legal aid, adult literacy, identity documents. I mean, this is amazing, just the sheer volume of things that you guys do.
Yeah, so with our work, we've kind of realized that not everybody needs the same things. And we really want to make sure that instead of kind of reinventing the wheel, that's why we like to work with partners who are like-minded. So that we know that if, some villages like Dalton was sharing really just need a good, thorough, exposure to human trafficking, because they get people telling them, one thing, but it's really something else is happening. And then once you get, really the village chief and people that are higher up understanding that this is not what's, they're lying to you, then you really see kind of a difference in the community. And so some places just need sort of a prevention and preventative methods, while others we have a home that we support for girls, and there are kids in there whose moms, who still have parents who come visit them, once a while, but they're not in a position to kind of take care of them. So they've left them at these homes, and it kind of ensures that these children are brought up in a circumstance different than what their parents had to go through, and they leave them there because they're aware of that themselves. They know that my child is better taken care of and following a different path here than they would be if they were with me. So we have safe places like that. We also do locally, we do some mending groups that actually happen for women outside of shelters that are not living in shelters. So we do groups where they can come and they can sort of just be themselves and have a safe place for them to really talk about all the trauma that they've gone through without anybody being there to just judge them, but just to walk them through sessions where they start the process of healing. And it doesn't happen overnight. It takes a lot of work to kind of start that process. But so we just kind of focus on needs and just make sure that our resources are being used wisely so that, we can help as much as we can.
Yeah, it's a big evil, that we alone can't really tackle that problem. So that's what we really partner with like-minded organizations to do that, not just in countries like India, but even here locally. And it's so prevalent here as we speak in our backyards, right? Recently, we did a project where we are still supporting, rehabilitated a few men who were being trafficked from a third world country. What happened was they were brought in here for cheap labor. They were paid less than $2 or $3 a day and asked to sleep in construction sites. And they were brought to our attention, and we are partnering with the local nonprofit here and with Ethne. We're actually teaching them now English, teaching them financial literacy. And Stephy leads those programs for teaching them English as well. And we're bringing all these resources together for them so that now they are empowered and that their next generation would not have to go through this, and they have a sustainable job. They have something that they can, a skill set that they can apply and earn an income, but at the same time, they're also aware of what's happening in the world around them.
I appreciate that you brought up that specific example, because I was interested in hearing about, how it is that you work with vocational training. So, because it's definitely the language thing is huge, right? That is a game changer when people learn the language of wherever they're living. So that's beautiful. Hats off for that. I have taught English as a second language, and it's hard work. It really is. Well, the other thing that I saw that you do is you ensure that there's protection and well-being by promoting good health and nutrition, as well as facilitating education and life skills. Tell us more about that.
Sure. Yeah. So I feel like sometimes we are spread so thin across all these areas because these are like massive projects, and sometimes we ourselves are overwhelmed. So we're only 3 years into the nonprofit space, and we're so proud of the work that we have done so far. And when we say healthcare and all that side, we really didn't have that in mind when we started Ethne. And we soon realized that's something very crucial for the overall well-being of anybody, right? And it really triggered, the projects really took off during COVID, and especially when the second wave of COVID hit the nations around. And we realized that so many people in these developing nations are under, they don't even have proper resources to get proper health care, and they are just dying on the streets, and they're lying on floors outside hospitals because they can either afford them or there's no facilities available around. And that's when we had to step up and say, okay, we're going to help in this area as well. And it was really overwhelming in the beginning. It was like, where do we go for the funds? Well, how do we implement these programs? But again, it's just that a passion stirring inside us. We need to help. And it's just taking that first step and helping one person at a time. And then it becomes 2, then it becomes 20, then it becomes 200. And then we put a program around it. And when we ask people, okay, come along, send and help. And it's just taking one step at a time, one day at a time, and just meeting the needs of people. And sometimes we feel that all these activities may not help us focus on what our mission vision is. But again, at the end of the day, whatever the mission is to serve people. It's to make lives better for everybody.
It's brilliant. I often, when I'm out speaking to people, I often use a question to get people to pay attention to what I say. And I open with, what will you do with your one precious life? It seems to me that you're doing something pretty spectacular with your one precious life. It's really wonderful. Let's grab our next break here.
I'm Alise Cortez. We've been on the air with Dalton, Divakaran, and Stephy, Divakaran, the founders of Ethne, the nonprofit organization that fights poverty while empowering vulnerable women and children. We've been talking a bit about what the organization does. After the break, we're going to hear more about these campaigns and their results. Stay with us. We'll be right back.
Dr. Alise Cortez is a management consultant specializing in meaning and purpose, an inspirational speaker and author. She helps companies visioneer for greater purpose among stakeholders and develop purpose-inspired leadership and meaning-infused cultures that elevate fulfillment, performance, and commitment within the workforce. To learn more or to invite Alise to speak to your organization, please visit her at alisecortez.com. Let's talk about how to get your employees working on purpose. This is Working on Purpose with Dr. Alise Cortez. To reach our program today or to open a conversation with Alise, send an email to Alise, A-L-I-S-E, at alisecortez.com. Now, back to Working on Purpose.
Thanks for staying with us and welcome back to Working on Purpose. One other bit of news I want to share with you is that the anthology I have been curating and working on for the last 2 years is now out. It was out in August. It's a collection of 25 stories from women across the globe who share the intimate details of finding their purpose and what they're now doing to serve from it. It's called Passionately Striving and Why, an anthology of women who persevere mightily to live their purpose, and you can find it also on Amazon. I'm so excited about it. I'm proud of it. I could bust. If you're just tuning in, my guests are Dalton Divakaran and Stephy Divakaran, the founders of Ethne, a nonprofit organization that fights poverty while empowering vulnerable women and children. I'm your host, Dr. Alise Cortez. So for this last segment here, what I really want to get into is hearing about some of these campaigns that you have put out into the world and their results. And so if we can go in a certain order here, the Afghan aid campaign sounded amazing. You were trying to raise $5,000 to assist refugees, keeping in mind what's been happening in Afghan, and this is October of 2021. So talk to us about that campaign.
Sure. So I think it's been so prevalent in the news, but until you encounter these families face to face, you really don't know the depth of what they go through and what they're facing. So one day after working out at the gym, I happened to drive by Kroger to pick up something, and I see a young family, husband, wife, and the kid was 7 years old. And they are standing in the parking lot asking for help. And I just stopped my car, I parked my car, and I walked to them just to hear their story and what they were going through. They were healthy people. They felt like they're smart, they're good looking, they're healthy. But I just but they had the board which said needed help. And I walked up to them, and I soon realized that they didn't speak English. And I started talking to them in actions, name, where, and I was so limited to have that conversation. But one thing that they showed me, I understood what they were trying to tell me, because they were tapping in their stomach and said, the basic necessities, they were hungry, they needed food. And I didn't know their story, and I usually don't give money to people who I don't know. It's just being due diligence to whatever that I'm blessed with, right? But I realized that they needed food. And it's like, why don't you come with me to Kroger inside? And I said, let's go, Kroger. And then they walked with me. And the lady and the son came. The husband still was outside asking for help because he didn't want to. It was kind of getting dark. Probably they wanted to make a few bucks to survive that night in a hotel or something. So as soon as I walked in, the first thing when she was passing the aisle, and she was looking at the shampoos and the soaps, and they were like, maybe And she was like, can I get one of those? And she picked up the tiny little bottle there. It's like, how long do you take the big one so it'll last you for long, right? And I was like showing all these actions, and every time they walked by something, they would look at it, and then they walk by us looking at the price of it.
Mm-hmm.
And I felt in my heart, man, it's not just for her, it's for her son, it's for her family. And anyhow, I walked with them through whatever they needed, got out, and then I really was intrigued by the story. And the language barrier was huge. I couldn't really understand what they were trying to say. But one thing I understood, he pointed, at the end of it, he pointed my attention to his feet. At one of his foot, he was actually being tracked by the American government because he was a refugee, and he had this smart alarm or tracking device attached to his feet. And that's one of the things they have. First of all, they're here seeking help, but they're being tracked for everything, and they don't have the money, they don't have the resources. And they have come through a lot of, tragic situations. There's so much of PTSD involved in their lives, and they needed counseling, and much more, they needed all these resources. And as I said, like, we sometimes spread ourselves so thin, but at the end of the day, we want to help people. So this was a small campaign to help with people who we come across, and we feel that we could make a direct impact and help with immediate resources, or point them to the right resources for a long-term rehabilitation, and make sure they are also successful in this country.
Mm-hmm. So the idea was to raise $5,000 and do what with it?
To help them connect with the right resources,
okay,
and to do case management, and also give them grocery kits for new families who are coming, settling down in the Dallas Metroplex area.
Okay, and how did the campaign go?
It went really well. It was during the North Texas Giving Day.
Yeah.
And we haven't still received the money from them because it was just a couple of weeks ago. So once we get that money, we'll either distribute it to the supporting local nonprofits, or we'll directly work with families whom we have encountered in the area.
Wow, that's so gorgeous. So you see, ladies and gentlemen, when you're out and about in your everyday life, there's lots of ways to be able to lift your gaze and see where you can help. And what I know as a local therapist, when we help and serve other people, it actually it's better, it heals us. It's that self-transcendence that actually it taps into our well-being or activates our well-being. So it's really good to do. You guys just do it over the hilt. Okay, what about this 5K for India?
Yeah, so the 5K for India was actually a campaign that we usually like to do one big event. And in last year, we didn't get to really do one because of COVID. So this year, when we were thinking of everything that was going on in India, all the horrific stories we were hearing about, deaths caused by the pandemic due to a lack of really a healthcare infrastructure, we really wanted to help in some way, and we wanted to make it as safe as possible if we were going to have an event. So Dalton, we were back in the day, we had thought about doing a 5K, just a general one for our organization, but we thought, hey, let's just do a 5K for India. And we literally named it 5K for India. And we picked India mainly because we had trustworthy partners there that we knew that if whatever funds we did provide would reach to the right resources. Sometimes when you work with third world countries, things like, getting the money at the right place, having to navigate politicians and all those people involved can be a little tricky. So that's why we primarily focused on India. But it was actually a really, really great event. We ended up with, I think, about 550 people participating.
Wow, that's awesome.
And it was at the White Rock Lake in Dallas. And it was a beautiful day. We had perfect weather. And we had such a great turnout, and people just really showed up. And it was a great experience just to come together. For a lot of people also, they haven't, really come together for an event in a while. So just to bring that sense of community and to show that, if we really come together, we can, raise funds and kind of collectively work towards helping people that are really suffering. One thing that me and Dalton, both having that healthcare background, it really kind of opens your eyes to, some people say, like, all it takes is a small virus to really show you all the flaws in your own healthcare. I mean, even in America, in some ways, flaws in the healthcare infrastructure. So think of how much worse it would be for third world countries. So that was something that we were really proud of how well it went, and we were able to really make a great impact. We were able to ship out ventilators, oxygen tanks, and a lot of and a lot of grocery kits to people that really needed help. And it was really a great experience for our team. We literally put together, usually professionals told us that a 5K takes about 6 months of planning. I think we did it in 28 days.
Of course you did.
And it was a lot of work, but we had some really good people to help us. And
We did it in 28 days because of the need. The situation was so
dire.
so dire. And the personal story that connects back to me is, again, my sister lives in India. She was diagnosed with COVID. She has 2 kids. She had to lock her kids up in the house and go to find a hospital where she could get oxygen. And she waited 8 hours to get a bed. And she was terrified. Her husband was terrified. We all were scared. Like, what's going on? We had the money to pay for the hospital, for the physicians. We had people who were in administrative leading organizations and healthcare organizations. And we knew them personally. Still, none of them could get them to bed. And she struggled to get oxygen for 8 hours. And for me, I was like, if someone who has all that resources, the money, the influence to get to a place to get basic necessity of oxygen, we couldn't get that. What are the millions of people who don't have that there? What are they doing? And they were like, without a second thought, we were like, we're going to help. And I told my team, we have to do something. We didn't know what to do. What I did is I just randomly walked into a ventilator shop here locally in Dallas, who makes ventilators for Army and for battle fields. And I went to them and asked, how much does it cost? I was like, can I take a video with these thousands of ventilators sitting here? Can I take a video that these are available? But it's not because we don't have ventilators available that people are dying. It's because none of them are stepping up and coming collectively together to purchase these or provide these to the people and they're dying. So that's where our campaign really started. Me just walking randomly into a ventilator shop. And it kicked off, and we raised, within a matter of less than a month, we raised close to $200,000. And not just the money that we raised, but there was a lot of donations that we given in terms of oxygen concentrators, ventilators, grocery kits. And we made a big impact. We saved lives. We brought joy to families. We helped people when they thought that was the last resort. They had nothing else in front of them. We provided hope. And we're so proud of the work, and I'm so proud of the team. And, I could only do a little bit, but, it's the team that makes it happen. I'm so proud of Team Ethne and how we came together to really help in such a dire situation.
So 2 questions. One is, when was this race? Because I didn't know about it, and I would have loved to have done it.
Yeah.
When was it?
July 26th.
Okay, got it. And then the second question is, are you going to do it again next year?
Yes,
We want to, yeah. We
Yeah.
would love to have a 5K for just general Ethne fundraising purposes. I think it's a great way to bring the community out.
Absolutely. And I live by White Rock. I'll come.
Yeah, and
Yeah.
people love. I mean, it's a beautiful place, and people just like. I think that's one of the things that the pandemic has done. It's just like whenever people get an opportunity to come together, and people were just really like, man, I didn't know how much I missed this until now. Like now, it feels so good to be out here and just together. So yeah, we would love to do it again, hopefully.
Okay, because I've done races, I've put on races before. When you have that repeat effect, it really makes a big difference.
Yeah.
People go, we got to run that race because it's for this cause.
Yes.
And even if the cause was catering to India, people here enjoyed it. Like, people came out and told us, hey, we haven't been out in a long time. This is awesome. And we really loved meeting people, and we really loved connecting back into the community. And that itself is, it's very refreshing, and it's very rejuvenating for people. We loved hearing that from people. And also the fact that we asked volunteers to come and join the cause. And there's this one lady named Sheba who was the race director. And she told us, thank you for the opportunity to make an impact. And she literally, within a span of 21 days, she went and got the approval from the city. She ran the whole project. She got the race, all the chips ready and the T-shirts and the marketing and getting the sponsors. And it was just beautiful to see someone blossom and come out of nowhere and say, no, I'm ready to volunteer. And for her herself to make that big impact in the community and for herself. It's life-changing, not for the people who receive it, but for the people who run it as well.
Mm-hmm. Yeah, you're not volunteering. You're in charge. And as you are in charge, you literally probably watched her molecules change and grow before your very eyes, didn't you? How amazing. That's the work that I get to do. It's amazing. All right, you said a little something before about the COVID relief, but say a bit more about the campaign that you did around COVID relief.
Yeah, so I think COVID relief and 5K for India sort of all kind of mixed together. Because initially, when we were doing the COVID relief, we didn't really have an event per se because we were still trying to be as socially distancing as possible. So we were just kind of doing a virtual campaign with COVID relief, trying to reach out to our donor base, and Dalton was on the news a couple of times. So he got to kind of share his story about his sister and why, it really, it was something that really struck a chord with us. And then from that kind of was born the 5K for India, the event itself. And so it all kind of was in this very short time span, but I think it was one of the most fruitful campaigns that we've had. Just I think sometimes Dalton says, like, you just have to go for it. You just I think sometimes when you're planning a lot, we have planned a lot for certain campaigns, and even though they have been successful, but I think this one was just, we were all on kind of like, felt like we were on steroids, and so we were just kind of like, going for it, and it really worked out, and it was really successful campaign.
And it didn't stop there, right? What happened was we understood all the flaws that's in healthcare infrastructure in developing nations. So what we did is, I took my experience at work, taking technology. Now we're implementing technology in rural villages where people can come and access a doctor. And doctors can listen to heart sounds, lung sounds, do ear exams, mouth exams, literally not being present physically, but virtually from anywhere. So we piloted a project in a couple of villages where people have not seen a doctor in their lives before. And the pilot is going really well. And in the future, we hope to expand it, not just to developing nations, but even in rural areas in the U.S. We're wanting to take the technology and the platform, and the work that we did in India to other parts of the world to make sure that everybody has access to healthcare. Slightly ambitious, I would say, slightly ambitious. It's just, I could say it's just too bad you guys aren't more ambitious. So we're coming to a close here, and I want to hear from each of you. First, just quickly, what are you each proud of? What are you really proud of in this work that you get to do?
I think I'm just really proud of how far we've come along. I think literally sometimes when I tell the story, I remember I was in the shower shampooing my hair, and Dalton was like, he was from outside the bathroom. He was just like, I think I want to start a nonprofit. I think I really want to help people. And of course, I can't hear you. In my mind, I was like, yeah, that sounds okay. We can help people. Sure, we want to help people. So I was like, yeah. And I think Dalton literally went and said, Googled, how do I start a nonprofit? And that's kind of how I think we, in some ways it's kind of funny. But in the last 2 years since we've done some tremendous work, and we've come so far. And I'm just really proud of our team and how they've all kind of, supported us in this journey to really make a difference.
Awesome. We're so close to being out of time, but just say 10 seconds. What are you proud of?
True passion finds purpose.
Way to finish.
And I get to live that.
Way to finish, guys. Dalton and Stephy, it has been miraculous.
Can I say something more?
Just very quickly.
If you haven't read Alise's book, it's about passion and finding your purpose. I highly recommend that. And the second one that came out with all the amazing stories of women who have taken their passion, their skill set, and found purpose. Through their struggles, they have given back to the communities. And it's just a phenomenal read. It would be life-changing for you. So please make sure you grab copies of those books.
So lovely. Thank you, guys. That's beautiful. You're so welcome. And listeners, viewers, if you want to learn more about this amazing couple and the work that they're doing with their team, go to their website. It's ethne.life. Let me spell it for you. It's ETHNE.life, LIFE. And thanks again to our partnering sponsor, WorkProud, which helps companies build a platform where your workforce receives meaningful feedback, and thanks for their work from people across your company. Last week, if you missed the live show, you can always catch up your recorded podcast. We were on with Lisa Gable, the author of Turnaround, How to Change Course When Things Are Going South. We talked about how her four process steps help leaders navigate their businesses with fluidity in the constantly changing marketplace we find ourselves today. Next week, we'll be on the air with Uni Torrentini from Norway, talking about the work she is doing to address the loneliness problem in the world by increasing our relational energy. See you there. Remember that work is at least a third of our life, so let's work on purpose.
We hope you've enjoyed this week's program. Be sure to tune into Working on Purpose, featuring your host, Dr. Alise Cortez, each week on W4CY. Together, we'll create a world where business operates conscientiously, leadership inspires impassioned performance, and employees are fulfilled in work that provides the meaning and purpose they crave. See you there. Let's work on purpose.